We're diving into a candid conversation about mammograms, what they are, why they matter, and how they're saving lives every single day. So whether you're gearing up for your first scan or you're just curious about breast health, this discussion is going to break down the myths, the fears, and the facts. It's not just about detection, it's about empowerment.
Yeah, that's right. And it's not just about detection, it's about empowerment, like you just said. Let's talk about mammograms. Dr. Brandon Bentley with the Department of Family and Community Medicine at Wellstar MCG Health is back with us this morning alongside student Dr. Natalie Kaler. Guys, good morning.
Good morning.
And welcome. Dr. Kaler, what is a mammogram and why is it so important to go ahead and get one?
A mammogram is a special type of X-ray that can look at the breast, and it can detect things like precancer or breast cancer. And that's especially important here in the United States, where 1 out of every 8 women will be diagnosed with breast cancer in their lifetime. So mammograms are so important because they can detect breast cancer in the early stages when it's more treatable. And that can help us reduce poor outcomes in the long term and help people get the care that they need.
And Dr. Bentley, how often should women get mammograms?
Yeah, so the guidelines out there do vary a little bit, and it's really important to have a conversation with your doctor about this. Those at higher risk who have a lot of first-degree relatives with a history of breast and ovarian cancer should consider getting screened a little earlier, and that conversation needs to be had about how early you're going to have. But in general, start having that discussion around 40. And think about whether that's going to be a yearly thing or an every 2-year thing. Especially once we hit about 45, that conversation needs to be had every year. Have that discussion. Some of the guidelines recommend every 2 years, but if you have enough risk factors, an every year mammogram is very reasonable moving forward.
Now, are men also at risk?
Men are at risk. There's no screening guidelines. That is certainly something that can get lost in the fray here. Men can get breast cancer. Very, very low amount. But for those men, they just need to be aware if they notice any change in the breast tissue, if they notice any lumps, bumps, or pain that wasn't there before.
Okay, well, Dr. Bentley, what are the risk factors for breast cancer?
So there are risk factors that you can't change, things like getting older, your genetic profile, so some are just more susceptible to breast cancer than others, but there are risk factors that we can change. So physical inactivity shows increased rates of breast cancer, and obesity shows increased rates of breast cancer as well. So those are things that are within our power. Drink less alcohol, get out and move a little bit more. That has been shown to reduce your risk. For those of you who have some increased genetic risks, that's why that screening is so important. Catch it early, catch it when you can still take care of it, and it's a relatively more straightforward attack plan rather than something that's a little more complicated.
One of the issues with women not getting mammograms is availability, locality as well. Dr. Kaler, where can women go to get screenings?
Your primary care doctor is a great place to start. Definitely have a conversation with them about when you're due for your next mammogram. Also, if you have an OB/GYN doctor, they can help you out with that as well. The health department is a great place to get resources and get connected with physicians in the area. And then, like you said, some people in the area struggle with insurance. Right. Wellstar MCG has a student-run clinic that provides free women's health care. They can connect you with mammogram resources as well.
Awesome. Well, Dr. Bentley, what should women do if they have concerns that they may find about breast cancer and themselves?
Yeah, so certainly knowing your own body is very helpful. It's not necessarily recommended to do a self-breast exam on a regular basis, but if you notice that there's a lump or a bump that wasn't there before, it's a good thing to pull into that discussion with your physician that you're noticing something a little bit different. If there's any sort of discharge, if there's pain, if there's, as I mentioned, a lump or a bump that wasn't there previously, talk about it. Talk about whether you need to have it examined, whether you need a dedicated ultrasound or a mammogram, because though we have screening mammograms, we can also do diagnostic mammograms if anything pops up in the in-between time.
We're about to run out of time here, but real quick, it seems like in the past number of years, even with colonoscopies, the age limit has actually gotten younger as we progress and get older here. Is that the actual case?
Yeah, so you're noticing, and definitely good to bring up with colon cancer, we're noticing that the incidence is increasing in younger patients. So our screening guidelines are to start screening at younger and younger ages. It's important that as we notice that we don't have all of the answers as to why we're seeing it in younger patients, but important for us to recognize that these patterns happen and get the screening done appropriately.
All right. Get those mammograms. Be sure that you get them on a regular basis as well, too. Dr. Kaler, Dr. Bentley, thank you so
Yeah,
much for
thanks,
joining us.
guys.
Thanks for having us.